We are ready to start. Welcome everybody. I just want to recall that we will have a round of presentation from our speakers, and afterwards there will be a Q&A session. So if you want to participate and ask questions, you can either raise your hand or type in the chat function, and the secretariat will give you the floor and open your mic. In the meantime, maybe it's better if everybody has their mic closed, mute, and I think we can start with our webinar. I will give the floor to Janos Bertok, the Director of Public Governance Directorate at the OECD. Thank you, Janos.
Thank you so much, and welcome everyone. We have 117 participants, no, it's 120 participants. So I'd like to first thank you for the speakers, and particularly Jeffrey Schlagenhoff, the Deputy Secretary General from the OECD, in inviting to open. This is the 4th webinar in the series on trust in government. So Jeffrey, the floor is yours.
Thank you very much, Janos. Good afternoon. Many thanks to the speakers and participants for joining today's webinar. This is the 4th webinar in our series, Building a New Paradigm for Public Trust. Today, we will focus on the public sector's capacity to address the crisis and the changes required to foster public trust. The COVID-19 crisis has put a spotlight on the critical role of public institutions, highlighting how a trusting relationship between people and their administration can make all the difference when addressing societal challenges. Evidence shows that the effectiveness of measures designed to address the COVID-19 crisis often depends on the levels of trust in public institutions. For example, results in 233 regions in 19 European countries show that in high trust regions, mobility related to non-necessary activities was significantly lower than in low trust regions, showing how better compliance to national health policies. At the same time, the choice of policy alternatives during the pandemic is linked to how people perceive government competence, meaning its responsiveness and reliability and governance principles, that is, its integrity, openness, and fairness. For example, in Finland and Korea, the reliability and responsiveness of service delivery were found to have significant influence on people's trust in government, according to OECD surveys. Management of the COVID-19 crisis can provide useful reflections about the future of public administrations in terms of adapting the design and delivery of public services to best advance recovery packages. The crisis has forced the public service to become more flexible and resilient. For example, information and communication technologies have enabled public employees to work remotely without affecting delivery and performance of services. These changes can foster innovation by facilitating exchange and collaboration across government organizations to address the complex challenges related to the recovery. In order to realize this innovation potential, civil servants need to be able to network both inside and outside the public service, incubating social innovation and leveraging the government as a platform. The webinar series, Building a New Paradigm for Public Trust, is helping us, through a dialogue with policymakers, data providers, academia, and civil society, to revisit the way we understand public trust to help countries respond to the COVID-19 crisis, not only in the short term, but the long term as well. In this respect, let me highlight 2 important findings. First, we need to collect and unpack more internationally comparable data on citizens' perception, evaluation, and experience with the public sector. For example, in the previous webinar, we heard that young people are affected by the COVID-19 crisis in a different way than older generations, while they tend to have much higher levels of trust in government and international institutions. Such data would provide countries with benchmarks to improve the implementation of recovery plans. The OECD supports the dialogue on relevant data and evidence. Second, in addition to monitoring the main drivers of trust in government identified in the OECD Trust Framework, it is important to understand whether people trust recovery policies to be sustainable in the long term. For example, if people expect the government will change the way public services are provided, they may decide not to rely on these services in the first place. The OECD will launch a Trust During a Crisis publication, gathering data and lessons learned through this webinar series to support design and implementation of the recovery policies of OECD countries. I want to thank all of you for joining us for today's webinar. And I'll now give the floor back to Janos Bertok, Deputy Director of the OECD Public Governance Directorate, who will moderate the remainder of today's discussion. Thank you again for the opportunity to join, and I wish you a fruitful discussion this afternoon. Yeah.
Thank you so much, Deputy Secretary General Schlagenhoff, and thank you so much for your opening remarks to set the scene. And you highlighted the critical role, but also the necessary capacity and how the public institutions, they play a significant role in managing the COVID-19 crisis and also for the recovery. And indeed, reacting quickly and innovatively has affected the effectiveness of country responses. And you also highlighted, and many other emerging data shows the relationship between institutional trust and the compliance with the measures taken by government. And I'd like to just bring up one more from an OECD, from a European member country. This is Denmark, which showed the relationship, very high positively correlation between political trust and people's willingness to follow social distancing. Why this is important? Because in the current context, when vaccines have not yet been massively available, interventions, this type of administrative interventions, like social distancing, are considered very much an effective option to curb the virus. So the growing social demand stemming from the crisis made it clear that public administration, they need to adapt, to keep with the expectations. And trust is in the middle, at the heart of this relationship. But mentioning one more recent poll, the YouGov poll, which showed in 25 surveyed countries that what citizens, they think is that governments, they more fail to act well or quickly, timely to manage the crisis. So in that sense, this fourth webinar in this series on trust in government, we have a very good opportunity to shed light on the role of government, and particularly what capacities, what data, what tools, what evidence you need in order to better manage the crisis. And I'd like to first start with Victor Lapuente, Associate Professor at the Department of Science and Political Science of the University of Gothenburg in Sweden, because his research deals with comparative public administration, and currently, I mean, you are studying this relationship between attitudes of public managers from different administrative contexts. So the first question, and this will be the same question for all the distinguished panel speakers, what preliminary lessons can you draw from the COVID-19 crisis about the future of public administration? So are public administrations ready to build back better? If not, what are the main governance mechanisms and what capacity, what reforms you suggest to be introduced? So, Professor Victor Lapuente.
Thank you very much. Thank you very much. I think now you can see the screen. Thank you very much, Monica. Thank you very much, Janos, and thank you very much, Jeffrey, for inviting me. I would like to start by some remarks that Jeffrey has mentioned. He has mentioned some research showing that trust in government, also trust in others, but also trust in government has an effect on reducing mobility in studies across European regions. In a study that we are precisely running these days with Andrés Rodríguez Posse at the London School of Economics and my colleague in Gothenburg, Nicolas Charon, we see actually that there is a correlation, an association between trust and government and lower excess mortality during the first months of this 2020. And to be more precise, trust diminishes, trust in government diminishes the deleterious, the bad effects of political polarization and social polarization on excess mortality. So on the consequences, I think, of trust are of utmost importance for the COVID. But actually, what I would like to talk very briefly is not about the effects of trust in government that I think since already, apart from this research, Fukuyama, at the very beginning of the crisis, Francis Fukuyama wrote an article saying that probably the main determinant of success in government response to COVID-19 is going to be having trust in government or not. I would like to talk not about the effects, but about the causes. What explains trust in government? I'm very particular, and again, connecting to what you have said before, Janos, about the need of having better measurements. We are not using probably the best measurements on trust in government, but we use our surveys that we have developing also for the European Commission and European Quality of Government, for example, on perceptions of which perceptions citizens have on impartiality, of the impartiality of the administrations, which perceptions they have on the lack of corruption, which perceptions they have on the government effectiveness in their region, in their area, or in their country. So what explains that? And basically, in this book with Carl Dahlstrom a couple of years ago, I think we summarize the very few things we have been able to assemble to try to explain this. And our goal in this book and organizing Leviathan is to, as you have mentioned, to emphasize the role, the importance of the workings of the public administration. Most of the literature focus on political systems, electoral systems, how we elect politicians. And we think that what determines most trust in government is not how we select politicians in a country or in a region, but how we select public bureaucrats, public employees, civil servants. So the thousands of people working in the public administration. And actually what we do in this book is to test two hypotheses, and we find confirmation for the second hypothesis. There is one hypothesis that for many years, for centuries, I think from Napoleon onwards probably, it has been justifying lots of reforms in the public sector, which is the idea of bureaucratizing, let's say, public employees. So let's make public employees not to follow the discretionary labor laws of the private sector. Let's have them enjoy special employment rules. They enter through very formal examination systems. They promote according to seniority and so on. And if we give this special treatment, let's say, to public employees, then we will protect them against political influence, and they will pursue the public service, and citizens will trust a government with these autonomous bureaucrats. And the other hypothesis that we try is that it doesn't matter so much if you recruit civil servants through bureaucratic systems like formal examination systems and so on. You can recruit them like in the private sector, like for example, more or less in Denmark, or in New Zealand, following several similar rules, flexibility, like in the private sector, but keeping the principle of meritocracy. So recruiting them according to their competence and merits and not to their political connections. So the degree of meritocracy. And what we find, and this is the main finding of the book of our research, it's the research of our lifetime, at least so far, is like that it doesn't, bureaucratization has no effect. There is no single effect. There is no single strong correlation or association or causation between the degree up to which countries have employees with special employment laws and any measure of trust in government or perceptions of trust in government. But we have a very strong effect of meritocracy. And just to conclude, wanted to show you at these graphs, we see zero correlation between the countries like Brazil or others who have highly, or Greece, or highly special, very special employment laws for employees, and the perceptions of the citizens about the control of corruption in a country. On the contrary, as I said before, New Zealand, Denmark, Sweden, with public employment laws very similar to those of the private sector, they get to manage, or the citizens perceive that there is lower levels of corruption. Also, the citizens perceive more government effectiveness in those countries. So there doesn't seem to be, at least from here, the need to bureaucratize, the need to give very special employment laws to public employees in order to get the citizens to get a perception, or in the international rankings about government effectiveness of the World Bank or whatever, it doesn't seem to have an effect on that. On the contrary, we see a very strong positive effect on the degree of meritocracy and the perception the citizens have of control of corruption, perceptions and realities as well, because probably Nicaragua and Venezuela, it's not only a perception, it's a reality. That, and you see in these cases that when these are countries with very low levels of meritocracy, where having a career in the public sector depends mostly on their political connections. And in those countries, you see high levels of corruption, low levels of control of corruption. And on the contrary, countries like Denmark, Sweden, New Zealand, with high levels of meritocracy and also more ability to control corruption. So basically, and this would be my final comment, I think there are 4 worlds of public administration when it comes to these perceptions the citizens have of impartiality, perceptions of government effectiveness, and maybe realities. I don't know. I think in many cases realities as well. The degree of separation of careers between politicians and bureaucrats, so countries like Mexico, Italy, or Greece, this reducing the analysis to the OECD, or even the case of Spain, countries where there is more political involvement in the careers of civil servants, and also the degree of openness or lack of bureaucratization or lack of special employment laws. So you can have, let's say, a meritocratic system like in the green cell, meritocratic administrations, and also flexible administration. So that would be the message summing up my short presentation. It seems that you might have both. Flexible, that follow the rules of the public and private sector administrations, but also administrations where there is a separation of the careers of the interest of politicians and bureaucrats, where basically the bureaucrats are not politicized but they owe their work, they owe their position to their own merits and capacities. And I will stop here my introduction. Thank you very much.
Thank you so much. Very interesting. And we could go back when we see the various factors influencing trust in government, and you highlighted meritocracy and the elements such as, the impartiality, of course, the process, but also the impartiality, the fairness in the decision-making process, but also flexibility. And I think in the current, the COVID-19 crisis management context, flexibility is similarly. But so let's go back later. But first, let's move the continent, and from Europe moving to the North America, and starting with Dustin, and as a distinguished speaker from the US, from the center of government, because Dustin is the Deputy Assistant Director for Management in OMB. This is the Office of the Management and Budget in the Executive Office of the President in the United States. So he is, a distinguished fellow of the National Academy of Public Administration in the US, but he has been also representing the US in the OECD Public Governance Committee. And in 2018, he was elected as the chair. So he is not only bringing the US experiences, but also representing this broader public governance community as the chair of the Public Governance Committee. So thank you so much for joining. And I asked the same question, which is linked to the preliminary, what you consider as the preliminary lesson from the COVID-19 crisis about the future of public administration, and how do you see whether the public administrations are ready to build back better, and what would you consider as a mechanism, as a capacity, we talked about a capacity for improving, reforming in order to better support such risk management.
Great, thank you, Janos, and thanks to Jeff as well for his introductory remarks. Great to see him again, as well as a number of other familiar faces, and appreciate the introduction from Victor. I'm very interested in following up on his findings, which resonate certainly with our experience here. I'd like to just make 3 points, and I'll try to be clear about what hat I'm wearing, Janos, as you said. And with the hat of the chair of PGC, I think one of the things that's worth noting is back in 2018, we worked on a new public governance mandate for 2020 to 2025. And I'd just like to read 2 sentences from that, because I feel like it captures quite well the sentiment. And I think reflecting on where we are, it holds up quite well on the topic that we've been focused on. We concluded kind of in the PGC mandate that the renewal of the PGC mandate offers a unique opportunity to take stock of what we have learned to date regarding sound government. The committee believes this is the right time to focus on increasing trust in government. To that end, focusing on 3 areas: the customers that we serve, the workforce that serves them, and the policies and routines that drive government's culture. Provide us the best opportunities to use an evidence-based approach to improving trust in government and the results that matter to the public. And I think for us, that really has been our true north in terms of identifying what the outcome of so much of the government reform work that we have all been passionate about pursuing for years, if not decades now. And I think that's one of the first times I've seen it written down, that trust in government is that final outcome that we are trying to achieve. And if you look back at the history of how governments have formed and the social compacts that were the very first originating agreements between citizens and their governments, I think it resonates quite well from a historical standpoint as well. So we continue to work across the different sub-bodies of the Public Governance Committee to identify how different reforms and actions can ultimately help improve our understanding of what the key drivers of trust are, and work through different models. So that's kind of the first point. The second point is, I think the COVID-19 crisis fundamentally is going to accelerate trends that were already in place. And I think many people have observed that, certainly in the private sector, but I think that's also true in government. And I think this becomes extremely important for government. We may have been thinking historically that we have a long period of time to pursue reforms, and we can kind of move at traditional paces for implementing some of the reforms and changes to how we operate. And I think hopefully this will kind of wake us up and shake us a bit to leverage to some extent the crisis to put in place reforms much more quickly than maybe otherwise would have happened. Because I think to keep up with the pace of change going forward, whether it's COVID or other challenges that are no longer respect organizational boundaries, we are going to need to operate in different agile ways and build resilient government institutions in a much more time-sensitive fashion than we ever have. So that's the second point. The third point is I'd like to put forward a new model that I think we all need to be exploring. I think at least I'll speak now putting my US government hat on, and although my sense is this will probably resonate with many countries, the traditional way that we've driven change to identify top-down policies in search of solutions, I think is increasingly irrelevant to the problems that we face. I think we need a new framework that really tries to use data in granular fashion to be able to identify problems and then use that to inform leadership actions. I think that sort of approach is not something that we do very well in the center of government. We don't do a great job of listening. We don't always get great feedback sources from citizens and customers of government services. And I think we've seen some research suggesting that trust in government is highly correlated with people's experiences with government services, especially as their experiences between interacting with a government agency and their experiences interacting with a private sector grow wider and wider. I know in the United States, trust in government, experiences with government services ranks last or near last compared to all other industries. And I think that is something we have got to focus on. I'll just do maybe one quick final 30-second example of how we've begun to do that in the United States with one of our agencies. And hopefully people will find this helpful. We've begun to use our employee survey data to map levels of employee engagement from high levels of engagement to low levels of engagement. This uses the example of our Transportation Security Administration, TSA checkpoints. And then in addition to that, we've begun to look at customer complaint data from each of the different airports, which you can see is now overlaid with our employee view. And so this begins to take the data we have in granular fashions and create visual tools that allow all levels of the organization, from the front lines up to leadership, to have one version of the truth based on the feedback from the people who matter most, our own workforce and the customers they serve. So the thing that I find very compelling about examples like this is it takes kind of the abstract notion of trust in government and serving citizens and getting feedback, and it actually makes it very real and tangible as a management tool that can be used to improve the communication, improve the identification of barriers, and begin to get organizations that are large and complex on the same page. Final case study I would mention is our Veterans Affairs Agency did a similar kind of initiative where they looked at reorganizing how the Veterans Affairs serves its customers. They created a 100-person team in the midst of a 300,000 person organization. Some would say maybe one of the largest, most complex organizations ever created. And they worked to transform all of what that organization did around the veterans experience. And they were able to improve the trust in VA to do the right thing among their members from about 55% to 81% in just a relatively short period of time, about 5 years. And so I think there's a lot we can learn from these case studies, and I'd be very interested in continuing the discussion with my colleagues on the panel and the participants joining today. Thank you.
Thank you so much, Dustin. And this is particularly interesting how you bring together the customers and also the workforce, and how you use the data. And this is really the granular data. This is the bottom up in order to refine what is the problem and identifying the problems, and also the policy solutions. So we will come back and what are the requirements for collecting the data and what type of data is considered most useful in the follow-up. But let's move back to Europe. And I'd like to now introduce and invite Margarita Gomez, who is the Executive Director of the People in Government Lab at the Blavatnik School of Government at Oxford University in the UK, because she was a principal advisor to the Minister of Public Safety, and she established the first policy lab in Mexico, which focused on applying behavioral science. And this was a very experimental method in Mexico 4 years ago. So, Margarita, what is your take from your government and academic experience? How do you see the lessons learned? What lessons governments can learn in order to better manage the COVID-19 crisis in the future? And what do you see as a necessary capacity to build this capacity and ability to build back better? So, Margarita, the floor is yours.
Thank you so much. Thank you so much, Janos. Thank you so much, Monica, for inviting me. It is a pleasure to be here and to share also the panel with very good colleagues, Dustin, with who I have been working on the strategy of the People in Government Lab, Adrian Franco, that I met when we were where I was in the Ministry of Public Security, and Victor, that is going to be talking in few weeks at the School of Government. So very delighted to be here. So I'm going to share my slides, and I'm going to divide my presentation in two parts. First, I'm going to show some data about how trust was related or is related with with citizens' behaviors, echoing what Jeffrey was saying, and then some of the findings that give us some good news about how changes on government's responses can have a immediate increase on the perception of citizens. And after that, I'm going to bring an idea and a model that we have been working at the lab. First, so at the beginning, very beginning of the pandemic, the last week of March, we started to rerun a big survey in more or less in 58 countries. We got around 100,000 responses. And what we wanted to understand and to catch at that moment is how citizens were responding to this, to the responses of the governments, if they were following the measures, if they were, what was the perception that they have. And we got some interesting data. Just as Jeffrey was saying, there was a lot of lack of trust on government responses. And more than that, also citizens perceived that governments didn't care about their safety, and they were not telling the truth. When we compare this between high and versus low middle income countries, we can see that there is a huge difference. Just what also Victor was saying, how this difference, how can we identify the difference in countries depending of the development that they have. I think that one thing that also we found that was very interesting is that this perception of insufficient response from governments not just affected physical health of individuals, but also mental health. And I bring that here because that is something that we haven't been talking a lot, but mental health is a problem that we are gonna have. And we saw that there was an important association and correlation between the perception that citizens have about insufficient response from governments and mental health. And also there was an association between not trusting government and mental and worries and depression. But there are some good news. So we analyzed the decision that the UK government took the 23rd of March. It's not that I follow the Prime Minister very much, but it was a huge change for us because it was a big change from one day to the other day. And we analyzed and we saw that just one change on the policy, being the policy very clear, very timely, and very this was a strong measure, we saw that the perception of citizens about the performance of government increased. Here is the performance on insufficient response, so this was a decrease. Then there was also a decrease on the feeling of worried. People were feeling less worried after the announce of the lockdown and of the policies. And we also found that was a relationship on a strong and clear government measure with trust. So these are good news because when we also see the literature that is behind this and also some other findings, we find that when there are high level of uncertainty, individuals look for, try to find institutions that help them to cope with the uncertainty. So this could be a good moment to try to increase trust in government. So what governments can do and what can we learn from this data and what can we learn about how government responded at the beginning of the pandemic? And I will say that there are four main insights that I would like to put here. The first one is like strong leadership matter. And I just bring in the graph that I presented before is before the 23rd of March, the leadership wasn't very strong, but after 23rd of March, we saw a very clear policy and they were stronger measures, but people felt more confident and people perceived that the government were taking actions on this. And I think that this will be one first insight, like governments need to start to take actions that are clear, that are timely, and that are decisive. Then effective communication, this is nothing new that I am bringing, but I just want to mix that the communication has to be, and I want to bring some insights from behavioral here. The communication is not just about content and it's not just about data. It's also about how do we communicate. I think that, and we have seen evidence that emotions, how do we frame the information? How do we compare the information? That stories matters, and also that the messenger matter. So I think that governments also need to think more about the way that they are communicating and how constantly they are informing to citizens. The third one is, in this moment of high uncertainty, I think that mainly if we are talking about federal or executive governments, we need to work more with the community trust, with local trust leadership that there is already there, in order also to achieve the challenges that we are gonna have in the future, such as the economic recovery, and also motivating individuals to get the vaccine once that we have the vaccine. And finally, I think that this is an extraordinary opportunity to rethink government. And I'm just presenting here the 3 horizon model that is like, we can just continue business as usual, or we can take this crisis as an opportunity to change the way that we have been thinking about public service. And I'm gonna highlight 4 points. The first point is about adoption of technology. And when I am talking about adoption of technology, it's not just about the interaction between government and citizens, what we have called e-governments, but also about e-bureaucracies. How can we modernize and make the processes that government have more innovative, and how can we use the technology? We are already using this technology. We also have we are leading the change of moving from one way of working to a new one that is remote work, that it will allow to think in organizations that can be more flexible, more agile, that can be also more effective in their response. And then what we have seen also, and we need to really work on that because changes don't stay by itself, is changes in the managerial practices. And finally, I'm just echoing what Dustin Brown was saying. We are thinking on this model about rethinking the people management or the public service. When we think about processes that are important, processes that have to be more agile, simpler, less bureaucratic, with more simple norms, and also technology using data, automatization, digitalization. But I think that this is what we are bringing to the table, is like, we need to put public employees at the center and try to understand how they play a role, how can we engage them, and how can we motivate them in the following months and years in order to really face the challenges that we are gonna have to work on. Thank you so much.
Thank you so much, Margarita. And we would come back, particularly when you shared your insights and the strong leadership, the communication, but also what is the impact of communication, how you measure and bringing the behavioral insights as a new aspect. But let's move from Oxford to Mexico City. And it's a great pleasure to invite Adrian Franco, who is the Vice President of the National Institute of Statistics and Geography. This is INEGI, and this is the National Statistical Office. He was before the Director General for Government Statistics and Public Security and Justice, and developed many of these indicators, collected many of these, and invented many of these data sets. And he also worked on international projects for improving the evaluation of government performance. So, Adrian, I'd like to ask the same question, that from your perspective as this is the view from the National Statistical Office. How do you see, and in charge of the data collection, how do you see the preliminary lessons, how the governments, they face and manage the COVID-19 crisis, and particularly whether and what capacity they need in order to build back better, and what you consider as significant in order to reform the public administration in the future.
Thank you very much, Janos. Good morning, everyone. Hope you are very well at this time. First of all, of course, to say thank you to Monica, to Janos, Jeffrey, Santiago, and to all the team at OECD, and also for my colleagues. Nice to meet you. Some of you are very well faces. It's a pleasure to see you and to be here. Let me share with you some slides in order to reply the questions that Janos is putting here. Let me find what is this? Here. Yes, here. WebEx. It's not WebEx, sorry, it's Zoom. Cancel. Wait. This is Zoom, okay. Let me share with you. Okay, I hope it is okay. Yes, okay. Let me share with you very quick some slides to tell you that this is a different perspective of this very important topics of this webinar and this conversation. And from the perspective of national statistical offices, I mean a provider of statistics, in the case of Mexico, let me tell you that even when we have autonomous constitutional autonomy, we are independent from the government, same as the central bank and the Human Rights Commission. We all the time we work with the policymakers, and this is very important. As Jeffrey, Dustin, Margarita, and many of you has stated, it is very important to, in order to increase and to the trust and to face the crisis, to have a constant dialogue between policymakers and population. But also behind in the kitchen, it is very important to have a dialogue between data producers and the government. This is very important in order to know how the situation is in a specific country. In the case of Mexico, we have a national system related of information and geography related to governance issues of justice and crime. And when we talk about governance, we include topics like public administration, government, civil service, public service delivery, regulation, trust, corruption, and so many other topics. And our main objective is to deliver information to policymakers at all levels of government. We have level of federal government and state governments, 32 state governments and local governments in order to make decisions. And of course, the dialogue is not just with the government. It is very important to dialogue, statistically speaking, with scholars and academicians, with civil society, with all the representatives in Mexico, for example, the prosecutors, the justice institution, the governors institutions, international institutions also, like OECD, the United Nations, different components. And this is very important for us in order to increase the quality of statistics and also the value and the use of statistics in order to make decisions. Let me tell you that it is regular, not this year, but it is regular that we produce information based on two main instruments. National censuses of government that in which we collect every day information from all the governments across the country. For example, the more than 2,500 local governments, we collect information on institutional capabilities or capacities, and also from the states, from the prosecutors' offices, from the judicial, from all the offices that deliver public services across the country. Also, we use another kind of instruments, very important, that are national surveys on victimization, on people in prison, on police, on civic culture, and so on. So many topics on related and in our national surveys. But specifically, I would like to stress the exercise of two important surveys in the context of COVID and public service delivery. The quarterly urban public security, that is every 3 months. Of course, we lost one survey in the middle of the COVID crisis because of the lockdown. But we have now a very recent or very fresh data. And the other one is the quality of government national survey, both for business and also for people and households. In this survey, in the quality of government survey, we explore more than 40 different types of formalities, payments to the government but because of the services, and requests for public services itself and the delivery itself. For example, water, police, civil register, municipal formalities, schools, healthcare systems, that we have several systems of healthcare, and so on. So we explore with this survey has a sampling of 35,000 households across the country, and we have data for each state and for more than 30 cities in the country. So this is very important because the data that we got from this survey is from December 2019, exactly when the crisis of COVID was starting in the world. And this data is from 2019, and I would like, for example, in every of these public service, we have several specific components or dimension of the service. For example, we ask regarding police service if you consider that the police is useful for you, if they protect you, if they can change the situation of insecurity. But in this case, in the context of COVID, for example, I would like to stress one very specific and very crucial service. It's healthcare service that is provided by the government. For example, we ask to the direct users, it means this is experience, this is not perception, this is experience of the people who went in 2019 to use, or they were users or customers of this service. We ask about the facilities, if they are clean and tidy, if the treatment is respectful, if they found very well-trained doctors, or the attention it is without any cost, or if they have enough medicines, etc., etc. And at the end, we ask about the satisfaction of the service, of this service and of the other services. But this is okay. This is normal. I mean normal because in the context of Mexico, this is normal because we see this situation every 2 years. But what about if we put this in the context of the crisis of COVID? For example, in December 2019, 80% of the users or the customers of this service, they experience crowded hospitals, 80%. So they went to the hospital and they found a lot of people, long time to be attended in the medical service. Or 45%, they experienced that the hospitals, the public hospitals, they didn't have enough doctors to attend the medical, to give a medical attention. So imagine this in the context of COVID. Of course, we don't have the data. Well, we don't have the data from March 23 to today, but imagine the situation. This is a structural issue that we have to face in the context of COVID. And of course, this is data for action because we give this data to all the governments. It depends on the responsible, the federal, the state, or the local. The satisfaction, for example, of these healthcare systems for the states is this in which you see in the 32 states in Mexico. And this is the photograph of December 2019, but as the crisis in Mexico was coming, we see a coincidence between these kind of failures in the health system, and was according to the crisis, the more crisis in one of two states. In the middle of the crisis, it means May or July in Mexico, we saw exactly a map like this, but with the higher problem of COVID. So it means that it correlates the attention, satisfaction, and the quality of the service with a problem that we face in the middle of the crisis of COVID. But for example, in the satisfaction, I stress, for example, here with yellow line, or I stress with yellow, the 3 different types of healthcare systems in Mexico. One is provided by the National Institute of Social Security. The other one is for people in civil service, and the other one is general in the States. But what about, for example, with satisfaction with the police service? 1/4 of the population, the total population in Mexico, is satisfied with the police service. We have a crisis in public security, and we have faced it. Margarita knows very well. We have faced a crisis for a long time. Now, 1/4 of the population is satisfied with the police. They don't trust the police. And another data fraction that we collect every year is, for example, the characteristics of the relationship between public servants and the public service delivery and the citizens and the customers. For example, and we collect information, of course, for example, of one very important driver of trust and driver of public service delivery: corruption. This is experience corruption by the customers when they go to fulfill formality, or when they go for they get a public service. For example, we don't have a corruption problem in the medical service, emergency or scheduled medical service. We don't face a problem with that. But this is not a problem, I mean, in the healthcare system. But what about contact with police? 60% of the people who has contact with a police officer in the country is victim of at least one act of corruption, 60%. So that explains what is the driver or one drivers of the problem of public security. Maybe we have to make more explorations, but it is the same, for example, with the municipal formalities or public prosecutor's office. So this is an important driver for trust. It is. And it is also a very important data for action, because, as I said, we give the data in a very disaggregated way to different governments in order to take actions related to this information. So trust is a very important issue. We have talked about trust. We measure also trust in different components of the society, with institutions, with interpersonal trust, with many actors, private and public. But for example, here, this is in December 2019, the proportion of population who trust in several actors. For example, 80%, 86% of the population trust in their relatives, or 75% they trust in the public elementary schools. But what about the governments? The federal government, for example, half of the population trust in federal government. 44% of the population trust in municipal government, and 40% in state government. Look at the federal government, for example. 2 years ago, it was 1/4 of the population who had trust in federal government. What happened here? In 2 years, it doubled the trust. Well, it could be maybe because of the election of a new president 1 year and some months ago, well, 2 years ago. And it changed a lot for the trust in federal government. So this is important. So we also look for the data related to trust, how the people trust in their local government in order to face urban problems, or the problems are there in the neighborhood. This is the data from December. I know this is September, the data that we collect recently. And the trust and the people in trust. And we cannot see changes here. But what about if we make a zoom in Mexico City? Mexico City is divided into 16 different local governments. For example, this is the level of trust in these local governments in Mexico City in December, and the trust in September. So at the beginning and after the high crisis, well, we still are in crisis, but months after. You see the level of trust in the local governments in Mexico City got less level of trust. And if you see some yellow spots in here, in that cases, in the middle of the crisis, that local governments were considered, well, with high problems of COVID, people who were sick, and the excess of deaths in that point. So maybe now a driver for trust is how the governments, specifically how the local governments deal with the COVID crisis. Of course, trust is related to corruption. It's very, very strong in all the actors, at least in Mexico, for example. This from the family to the political. Well, of course, in Mexico City, in Mexico as a country, as you see, maybe nobody trusts in the politicians. So here, as you see, this is a trust against. And what about, as Dustin and Jeffrey said, something that is very related to these graphs? Trust and public services. For example, in the federal government, we don't find too much relationship between the public service delivery and trust. But what about the state government? The state government and local government, municipal government, it is very strong relationship between the public service delivery and also the trust in that government. For example, when we talk about police service or streets and avenues, if they are clean and they are in a very well shape, or what about the public gardens? The same as municipal government, there is a very strong relationship between the public service delivery and trust in this kind of governance. So this is a very important driver. Yes, as my colleague said already, it doesn't matter who we elect. The issue here is how they deliver public services and the relationship with trust. Also, trust and perception. This is perception. The other one was experience. Perception of corruption is absolutely related to trust, but in state governments and municipal and local governments, not in federal government. Federal government has another kind of relationship with the trust and its drivers. And at the end, Jeffrey said, for example, very important, that we have, and also Margarita, that we have to construct a new kind of government in this crisis and after this crisis. Let me give you 3 borderlines in Mexico. For example, half of the population who request for public services or make formalities had a problem. A specific problem with barriers to deliver, to fulfill the requirements of these formalities, but half of the population have a problem. What about when we talk about e-government or e-bureaucracy? For example, just 1/3 of the population has some contacts with with several governments through electronic platforms. It means internet or any other electronic platforms. And what about if we ask the people, the proportion of people who request public services or they complete formalities using internet is just 9%. And I leave this here because we are going to have a kind of discussion. Thank you so much.
Thank you so much, Adriana, and you put so much data, and also this would be very interesting to see the relationship between the satisfaction survey results and also the service provider. You mentioned like the health services. You have East, EAMS, I mean the various different actors. But let's move from Mexico City to north and in Ottawa and learn from the Canadian experiences. And thank you so much, Nicholas, for joining us. Nicholas is the Director of Strategic Policy at the Treasury Board Secretariat in Canada. So you have been leading the work on advancing the policy thinking around good public sector management and the role of the federal public service in Canada. But before, you also worked in leading the labor program innovation unit at the Employment and Social Development Canada. So you helped set the policy requirement for the government of Canada, how to measure the results. So thank you so much for joining. And just one personal comment that as you had a PhD in behavioral economics from the University of Oxford, I'd like to, in the next round, particularly bring this BI perspective and understand the impact on the individual, how the measurement, and how this also includes this new dimension. So asking the same question, and from the Canadian perspective, how do you see the preliminary lessons and what lessons you can draw from the COVID-19 crisis about the future of public service and how the public service is ready to build back better, and what mechanisms, what capacity do you see essential in the future?
Thank you very much. And thank you very much to all of you. It's great to be here, and it's been really interesting to hear from all the other speakers as well. As the others have been speaking, I've been trying to decide where I want to focus to sort of be as helpful as possible and not duplicate what others have said. So I think what I'm going to do is talk a little bit about a specific project we in Canada did as part of our COVID response that I think might be an interesting case study. And then I'll talk about 3 lessons I think we can draw from that speak to the broader context. But I also think there's been a lot of interesting things said so far today, and there's lots to talk about. So I will try to keep it short. The other thing I'd say is that this is still very much interim for us, as I expect it is for all countries. We're still responding to COVID, we're still figuring it out. And so there's an ongoing process of trying to learn from this as we go. And I think we'll keep learning as we go forward. And so there's sort of a continuing cycle of feedback and adaptation as we go, at least when we do it well. So in Canada, like in all countries, or most countries, I suspect, there was a massive response from the public service to COVID. There was a huge push on both the public health side of things and on the income support side, as we tried to protect Canadians' health and ensure they could sort of weather the crisis from an economic perspective as well. Within the public service, that meant a number of things. One thing is we wanted to make sure we were prioritizing critical government functions and services and make sure there was continuity of service. Just because we were trying to adapt to the crisis, there's still essential things that the government still has to be able to deliver. And so we want to make sure that was still the case. 2, we suddenly needed to move a lot of talent around. Places that were important but not that busy suddenly became the focus of responding to the pandemic. And so we had to be dramatically more flexible in terms of how we did our HR and how we move people around than we normally do, as we tried to focus people where they were most needed. And then 3, there was the really practical changes that all of us are still experiencing in terms of almost overnight, everyone started working from home in March. And so we had to sort that out. And though we had some people working from home before that, this was a huge shift for us. My own department's focus, Treasury Board Secretariat, is the sort of management board for the Government of Canada. So it thinks about good management of the public service. And one initiative I think that might be of interest to all of us, and that is very much linked to Margarita's points on communication, was our work on an app for get updates on COVID-19. So in March, we were getting 13 million visits a day from Canadians, and we did a poll, and about 90% of them wanted information on COVID, unsurprisingly. And so we wanted to create some sort of system to give information to Canadians that could be a trusted source of information. Our usual approach to doing this in the Government of Canada is to have highly approved comms lines that take considerable time to be released. And that tend to be tied to a very specific calendar well in advance. So when you have an announcement about food, you tie it to National Food Day. I suspect that's a shared experience with a lot of governments. And so the question was, how do we do a very flexible one? How much information do we provide? How often? What kind of information? How do we make sure it complies with our rules around time zones, bilingualism in Canada, accessibility, and make sure it's user-friendly and focused on what Canadians actually want to know? And so in the spirit of stealing good ideas, we took the Notify application that the UK had developed with their kind help and put it into place to build an app of our own to sort of notify Canadians about information on COVID-19. And so we borrowed from our wonderful friends in the UK and tried to set up this apolitical, non-promotional application that was just giving factual information to Canadians. What's happening, where are things at, how's it going? The reason I think it's an interesting example is a couple of things. One, it was a totally different approval process. Trying to respond to COVID, there was not time to do a 2-week approval on each message. And so it had to be done in a different approval process. It required a lot of cross-department collaboration. Content generation was very different. We had to do it with other governments. We engaged the provinces, we talked to the UK, we engaged others. And I think most interestingly and related to trust, what we want to do is focus on the user above all that else. The goal was to figure out what do Canadians want to know and then give them that. And I think in the context of service delivery being so important to public trust, as the OECD has found, that's really been an emphasis, is to make sure that we're thinking about the user needs. So quickly then, 3 things we're thinking about in response to COVID, and 3 lessons learned from us. And I will say, the reason I started by saying I think it's an interim response is because we're still seeing interesting changes. We've seen a decline in the trust in government information since March, for example. We don't yet know why. And so that's work in progress, try to figure out why, but we're wondering if Canadians have just sort of gotten used to this type of information from governments and no longer see it as notable or what's going on. But I think one lesson learned for us is that we need a flexible public service. We need to be able to respond to a crisis and reallocate talent, reallocate focus, priorities, get things done quickly. And that if the public service is seen to be slow moving and Leviathan, it will be hard to have Canadians trust us. From my department's perspective, that means we're particularly focused on digital government and human resources. We need good service delivery, we need good digital services, and we need to be attracting and retaining the talent we need. And though I'm trying to be quick, so I'm not going to talk about this point in particular, I think an aspect that's sometimes lost in this conversation is that our employees are also Canadians, most of them, and their trust in government also matters. If we don't have employees who trust that our government can deliver, it may be harder to get the citizens to also trust us. A second lesson learned is data. This is something that's been talked about a lot in this today and also in other OECD conversations. But I think what's been very salient in the crisis is the need for disaggregated data. The pandemic is not a uniform thing across a country. It varies by region, by group, and the same for trust and the same for other things. And so we need to figure out a way to collect disaggregated data while respecting privacy, while respecting other considerations, and then also share it. When we think of public trust, we think about open government. How do we make sure we're giving Canadians the information we've collected in a thoughtful way? And so we're publishing data on our open government portal. Statistics Canada has a COVID-19 data hub, but we're still thinking of what's the right amount of sharing of information and how do we make that meaningful to people who may not be looking for the Excel spreadsheet, but want to understand what we're seeing. My final lesson learned, and I think for me the most important one, is that we really need to make sure we're focusing on outcomes and not tools. It's very easy for us to sort of default to, well, there's a problem, what tools do we have to solve it? But I think what COVID highlighted to us is that we also need to make sure we're thinking about what outcomes we want to choose. If we don't have the right tools at the federal government, to the provinces, to the cities, are we starting with the outcome, what do citizens want us to achieve, and then working back from there to figure out, well, what can we do about it? And I think one of the things that is most frustrating for Canadians is that they don't really think about the different levels of government as different groups. They think of government as a monolith. And so poor service delivery from one group, I suspect, though we don't have the data yet, makes them think less of government as a whole. And so we're thinking about how do we as governments across Canada work together and leverage the expertise municipalities have or provinces have, as well as the federal government, to sort of do a coordinated response that really addresses the outcomes Canadians want to see. And that's about collaboration between governments, and it's also about being user-focused. It's about thinking first, what do Canadians want? What do the citizens want? And then how do we give them that? And it's also related to data sharing and common data standards and all of those pieces as well. And then I think a final thing I'll mention, which we're still thinking about, is how do we make sure we're learning from the pandemic? We've been forced to experiment with a lot of new ways of doing things, including new ways of informing Canadians, but also new ways of doing HR, new ways of delivering services, new ways of working. And I'm sure there will be some things we want to keep and some things we don't want to keep. And so we want to make sure we've got a policy in place or got an approach in place to make sure we're learning from that. And I don't think we've cracked that yet. And in part, it's because we're still trying to respond to the crisis at the same time. But we'd very much like to make sure we're learning the lessons from this experience, because it's so easy often, once you're done a crisis, to start moving to the next big thing. But if we can't gather the lessons from this one, I think we'll be less well prepared for the next one. And so we have some thinking on that, but we haven't cracked it. But there you go. Thank you very much.
Thank you so much, Nicola. Very interesting. And also how this resonates with the previous experiences, and just linking to Dustin's new model and how you see the, the granular data, but also the user-centric, the user focus, in order to better reflect and make the necessary flexibility. So moving to the other side of the Pacific, and invite Rodney Scott, who unfortunately couldn't join in person, but he has a recorded presentation. So I invite colleagues to start this presentation. So Rodney is a Chief Policy Advisor at the New Zealand Public Service Commission.
Kia ora from Aotearoa, New Zealand. My name is Rodney Scott. I'm the Chief Policy Advisor from the Public Service Commission of New Zealand. Thank you to the OECD for the invitation to take part in this webinar. Unfortunately, New Zealand is about 12 hours ahead of France, so it wasn't possible for me to participate live, and I'm pre-recording this instead. New Zealand has to date had a very successful response to the pandemic, and I want to talk a bit about some possible reasons behind that success. But I think it's worth mentioning at the start that countries are not directly comparable. There are various contextual reasons that made New Zealand's experience with COVID more or less difficult. We came through this crisis well so far, but that's not to say that New Zealand public service, government, or the New Zealand public are better than or more capable than others. In these situations, the context really matters. It's also worth mentioning that decisions that look good, really good in retrospect, weren't nearly as obvious at the time. New Zealand's an island country of about 5 million people. It's got particularly high rates of international travel. International tourism is a large part of the economy, and a large number of citizens live offshore. So when COVID hit, New Zealand quickly recorded about 1,500 cases. Then New Zealand went into a very strict social distancing protocol. Most workplaces and all schools and universities were closed. People worked and studied from home where possible, and people were told to avoid leaving the house for any unnecessary reason. It was one of the more extreme examples of social distancing in the world. Within 2 months, the virus had been completely eliminated, and life largely went back to normal. Although we continue to detect cases in quarantine facilities, at the time of this recording there were no cases of COVID-19 in the community in New Zealand. Despite no cases, it's inevitable that further cases will reach New Zealand's shores and will slip through. New Zealand therefore continues to be on the lookout for new cases and has one of the highest testing rates in the world. New Zealand recorded 22 COVID deaths during the first wave and a further 3 during the Auckland outbreak. So there've been a total of 25 COVID-related deaths in New Zealand. That's a total of about 5 deaths per million population. Around the same as Iceland, as the 2 OECD countries with the lowest per capita death toll. In explaining New Zealand's success, I'm sure there's a significant portion of good fortune and beneficial geography as an island nation. Having good public services and particularly an effective public health system was surely an advantage as well. But other OECD nations have these things too. So why then did New Zealand have so few community cases? A big part seems to have been the high rate of community voluntary compliance. So to an extraordinary degree, New Zealanders complied with the government's instructions, and this is why community transmission could be eliminated twice. There was comparatively little enforcement activity, so where other countries had strict policing of social distancing, New Zealand relied to a significant degree on people choosing to follow the government's instructions. In part, this is likely to be related to New Zealand's cultural context. New Zealand is a bicultural country governed by a living partnership between the British Crown and the indigenous Māori people. If we look at the various measures of cultural difference and similarity, whether it's the work of Hofstede, Triandis and Segelis, Geefend or Schwartz, we can see that Anglophone countries tend to be strongly individualistic and Polynesian cultures tend to be strongly collective. And New Zealand sits somewhere in the middle, which might explain why it was better able to achieve more buy-in to the initiatives that are about collective action. I think it's important as we talk about things like the determinants of public trust that we acknowledge the cultural context and cultural differences between different countries. The second contribution was likely to have been an effective social safety net. So in New Zealand, it was toward the more generous end across the OECD of wage subsidies to maintain employment during the crisis. And there's a real focus within the public service on processing these quickly with a 2 working day turnaround on applications. We just think from a hierarchy of needs perspective, it seems intuitive that it would be easier to buy into the higher virtues of collective action when your lower level needs of food, housing and safety have been taken care of. So the third area that's likely to have been important is trust in government, which is the main focus of this webinar. New Zealand has relatively high levels of trust in government, and unlike in several other jurisdictions with comparable systems of government, this has remained high and indeed increased in the recent years. We have several local measures of trust as well, and these have been trending up over the past decade and surged to an all-time high during the pandemic. One thing the Public Service Commission has been focused on is sharing stories about what we call a spirit of service to the community, profiling essential workers and what they've done to help New Zealanders during the crisis. These have been shared extensively across social media, and we hope, but have not yet measured directly, that this will lead to increased trust and confidence in public servants working at the front line. We've also been really focused on the integrity of the public service, particularly around 5 key principles: political neutrality, merit-based appointment, free and frank advice, open government, and stewardship. The people delivering public health messages have been politically neutral experts. There's been a unity of messaging, with these messages coming from a single source, the Ministry of Health, and then these have been amplified by others. The public can access free and frank advice provided to ministers to help them make decisions, and information shared with the public is based on independently verified statistics and the expert judgment of non-partisan career public servants. Finally, public servants have an obligation to act as good stewards for the public service, which meant that during peacetime, that is the time before the pandemic, public servants had a proactive duty of care to maintain plans, regulations, and capability. These 5 principles stood us in really good stead. So I'd encourage people to look at New Zealand's Public Service Act, and particularly sections 11, 12, and 13 that set out these principles, and particularly how they're given legal effect in a transparent and instrumental way in some detail. These were put into law because of concern that these may have been eroded in other similar countries, and the New Zealand government chose to act preemptively to preserve them and protect them against any potential future political influence. We're really interested in talking to other countries about what public service can do to promote public trust and confidence, and so I'd be happy to hear from other OECD countries and share our experiences more. Thank you, and noho ora mai.
Yes, thank you so much. And after this first very insightful round, I'd like to give the opportunity for each of the speakers, if you have any additional views or any comment, any new points or issue what you would like to raise in relation to the insights you shared. And at the same time, also I'm opening the floor so for the participants, so please send your questions in the chat functions. So any comment, any issue you would like to raise?
Very briefly, I don't know if I may. Yeah, thank you very much. Just very briefly, that I think that I've learned a lot, so much that I am overwhelmed. But I would like, since we have talked a lot about individual countries, and from a comparative perspective, still it's very and you know more than me as well about this, but it's very early. Too early to call what's going to happen with trust in government after the pandemic and so on. But I think we start to see like a dual behavior. I mean, the study of Bal and others of 15 Western European countries, and probably you would include New Zealand as well. That would be obviously the case as well. You see an increase of trust, and following what Margarita has very nicely summarized, increase in trust in countries after the lockdown. So after the governments do nasty things to you, let's say, but forced, the citizens understand that. And even there has been also an increase, which is also symptomatic as well, an increase of, like, I think, remember correctly, a 4% increase in the opinion polls for support for the party in government. And you contrast that with what is happening in many other countries, unfortunately among them Spain, but as well as many other countries worldwide, where I think, according according to latest indicators, it's like of the 80 countries in the world are suffering a decrease in civil liberties and freedoms and political freedoms and so on. Probably many of those countries, Eastern Europe and Southern Europe, you are suffering as well a decrease in trust of government, and you see exactly the opposite. So the same kind of measures lead to a decrease in trust on government. So this dual effect, which depends probably on factors that have been summarized here: transparency, openness in government, meritocracy in the bureaucracy, impartiality, and so on, might matter a lot. But I would like just to point out this kind of emerging dual trend worldwide. Thank you.
I mean, thank you so much. And this is very interesting because from the beginning, Victor, you emphasized the meritocracy as a critical. And in some other insights, there was more emphasis about the flexibility. And it was particularly interesting, Nicholas, when you picked up that there's an expectation about continuity. So what are the so-called essential services, public services? How you define these services, how you mobilize the necessary capacity in order to maintain, because this is the kind of ultimate defense line, you know, when the citizens, they expect the government to deliver some essential basic services. So how do you see the impact of these factors in the COVID crisis? Because this is not business as usual. This is an emergency. It is managing the emergency. How you see the traditional factors influencing, and you highlighted, you know, openness, transparency, anti-corruption. I mean, all these engagement, all these elements. But in the COVID crisis context, what really matters? What are the most essential influencing factors for trust in government?
I can make a first attempt, though.
Thank you.
But I think so. It will depend on the crisis, and I think, at least in our case, and I suspect in most cases, people understand that during a crisis, things are different. It will take longer. Like, clearly, people have to focus on the health response. If your paperwork's going to take a little longer for something else, I think there is a forgiveness for that to some extent. Only to some extent, and so I think, particularly as it becomes 6 months or 8 months, there is a I still need my immigration paperwork done, or I still need to cross the border, or that kind of thing. I think the most challenging cases, though, are where the two interact. And so you have a situation, for example, where borders are closed, and so in Canada's case, immediate family members can still cross borders, but because adoption paperwork is slowed, someone's family can't reunite, when if adoption paperwork was moving more quickly, they could reunite or something like that. So I think the challenge is always in those like unexpected intersectionalities between different policies, where in theory, I think a lot of people are like, well, and I've chosen a random example, but adoption paperwork's slowed, and so like we understand pandemic response is the priority. But then when they interact, you get these really difficult situations where there is a tangible human cost to trying to sort them out. And it is a very challenging balance. Where do you allocate your resources when you have a finite number of people and time to pay to things? And you like pandemic response will consume every scrap of time and energy you can pour into it. None of that answers the question very directly. I'm not sure I have a list of what are the core services we have to deliver. But I do think it's probably a sort of almost a case by case to some extent, figuring out what are the basic things that even when you're in a COVID crisis or any crisis, citizens have to have. And then what are the ones that, given this particular context of the crisis, will make things very difficult for people. So to take an easy example, had the mail stopped when everyone was in lockdown, it would have been very difficult. Whereas for the crisis different and not involving a lockdown, maybe mail would not have been so crucial. So I think it's something you have to think about as each crisis begins and goes.
Maybe I just will add that what we saw in our data is that worries and uncertainty is what is affecting more people now, and the main is what is affecting also like the relationship that they have with government. So I think that when we are talking about crisis in this moment, like as Nicholas was saying, information that is timely, that is clear, that communicate the situation to people might be one of the things that are very important, one of the main priorities in government. And I think that if government can reduce this level of uncertainty that is characteristic of the crisis, that is a good step in this period of uncertainty.
Yes, thank you. Dustin?
Just quickly, and then I really would love to hear if some of the participants have questions as well in the time we have remaining. But I think it's worth recognizing that government also manages differently in a crisis. And I do think there are opportunities to take lessons that we can learn from how we manage during a crisis and apply them to issues that are important, but maybe don't have the same urgency that we're facing today. For instance, being able to work across organizational boundaries, being able to work more collaboratively with subnational jurisdictions. There is a forcing function that really creates, I think, an urgency and a kind of, to a large extent, dissolving of organizational boundaries when it's extremely clear what the need is and what the urgency of a situation calls for, that I think we often struggle to define it so clearly and work across organizational boundaries as well in kind of non-crisis situations. So I do think that it's important for people like us to recognize that, to document it even, and think about other situations where we may be able to apply, whether those are issues that have secondary or tertiary effects stemming from the COVID crisis, or things that may be longer term in nature. That's definitely kind of one of the takeaways, that not just in this crisis, but in previous crises, I think we've observed in government.
This is excellent. And just picking up one element, which is you mentioned the unexpected, and what is necessary as a capacity and also for the anticipation. So what is necessary to improve or change in order to better anticipate, for example, the changing expectations because of the digital transformation, the impact of the digital transformation in public services, or how do you use the new potential of communication? These are the digital tools in order to better impact. And we talked about the behavioral insights, how to really have an impact on the actual attitude in relation to like social distancing, many of these specific government measures. So how do you see the public communication, and particularly when you are in Canada, US, or Mexico, federal governments? So the communications across the levels of governments, the coherence and cooperation across levels of government.
Don't know if I would.
Adrian first.
Yes, in the case of Mexico and in many other countries, for example, one very important thing in relation to communication is the source of the communication and the data they give. For example, in the case of Mexico, we have sometimes differences between what the federal government communicate with some data and what the states, the governors, and the responsible for healthcare systems in the states communicate. So they crash each other, and sometimes they say, well, our local government says something that we are doing very well or doing very bad, and the federal government is saying another thing. So suddenly, in the middle of the crisis, they realized that it is not possible to keep in this crash between the federal and local government. So they start doing together and agree. And of course, the agreement and the consensus is very difficult between this, because one of the important drivers for the trust in governments are how they manage the COVID crisis. And I am sure that, for example, the amount of the trust in local governments and even in the federal, but much more in the local governments. The amount of trust that the government had before the crisis, it is affected because of the way in which we now see the governments manage the crisis. And of course, the priority changed, because now, for example, public security or transportation are not the priorities, maybe, but what about mobility? What about public transportation? What about the economic recovery? So if the governments doesn't manage very well mobility, to make a good balance between lockdowns and mobility, and then lower the restrictions of social restrictions, and keep in a very well way the management of healthcare systems, of course, we will see affected the trust in governance after the crisis. Janos, thank you.
Thank you, Victor.
No, thank you very much. Yes, regarding the communication, I really like I don't hear a piece in Public Administration Review by Professor Jae-moon on the experience of Korea. And then I think he points out this kind of paradox that many governments face, that in Korea apparently got it right and other countries got it wrong, which is the idea that when you become, in the beginning of a pandemic, when you become very transparent, at the beginning there is a lower of trust in government because you are honest, and people don't like too honest and don't like to hear the truth at the beginning. But at the end of then there is a moment in time in which it changes, in which it's better to be much more honest. And that reminds me, and that is what the Korean government did, be blatantly honest at the beginning, getting a decrease in the trust in government, but immediately afterwards, middle long term, much better. Quite exactly the opposite we experience in many European countries, like in Spain, for example, where you had a government that at the beginning, different governments of different colors at the regional or a national level would try to let's say, hide it or give less importance and react, let's say, and then that was good at the very beginning to keep calm the society, civil society and business organizations, but at the end up causing more damage in transparency. Thanks.
Thank you. Any other view from the speakers? If not, I'd like to open the floor, and from the audience we have several requests, Michiko Nakamura, Reynaldo Castro, and also Jeff Guay. So can we start with the first question? Michiko Nakamura. Could you please ask your question? Okay. Could you please introduce yourself and ask your question? We can't hear you, so if you could move to Jeff. Yes, please. Would you introduce yourself?
It's okay. I sent one question and other commentary is maybe can you have an answer for me? I to invite you to be my partners in the promotion of the culture transparency in the reform of Article 28 and the Declaration Universal Human Rights. I send him the message. Maybe can you see? I wait your answer, please.
Actually, we were very efficient because you received the responses in the chat function. So, but of course, I'm inviting if you would like to give more details to this question. Okay, so if there's no, maybe just moving to Jeff. Can you hear us? Could you please introduce yourself and ask your question? can't hear you. Yes, could you please introduce yourself? Jeff, we cannot hear you.
Hello?
Yes, yeah, now we can hear you.
Okay, sorry about that. Some kind of technical difficulty. I'm Canadian and I've lost visual here.
It's all right. We can hear you.
Okay, my question is for Nicholas. First of all, I'd like to say thank you to all the panelists. I've enjoyed this seminar and it's been very interesting. I'm a little surprised with you, Nicholas, that you seem to be not sure why confidence in the federal government has dropped severely during the pandemic. And I'm wondering how you cannot look at the other scandals that have taken place in the federal government and see how that has reflected in the evolution of the pandemic.
So I wasn't actually thinking of political polling. You're right, there are all sorts of political events going on. Rather, I was thinking when we do messaging on the pandemic to people, like we ask, like, is this messaging useful, that sort of thing. So I was more thinking like, we're finding less interest in the government messaging in terms of is the source of information about the pandemic. And we just haven't had the opportunity to ask the questions of why, like maybe they're finding information elsewhere, maybe other trusted sources have arisen. I'm sure the factors you raise also play a role, but we just haven't had the opportunity to like ask or find out why, to be honest.
Okay, anyone would like to also comment on this question?
I would like just, it's not about exactly about the question, but more about some ideas about also like exactly with the messaging regarding the pandemic. It might be also like people are starting to have a fatigue about listening a lot about from the pandemic and overload of information. They have information from the local government, the NGOs, even from the church, you know, like there is a lot of information coming that could be, and also people get used to. What we have seen from behavioral science is like some interventions that are minimal interventions, people get used to the information. So it is good to be, I don't know if you are doing that, changing the type of behavioral insights that you are using to deliver that information. Just some ideas there.
Okay, thank you so much. Anyone else? If not, I'd like to invite again Michiko Nakamura. Could you please introduce yourself and also ask your question? Can you hear us? We cannot hear you. Your mic is unmuted, but we cannot hear you.
Or maybe
Can you hear me?
Yeah. Yes.
Yes,
okay. I'm so sorry for the technical problems. The internet has been very good. I enjoyed, thank you very much for the panelists for the very interesting presentations. I'm really interested in the Mexico's cases. The data were different, the federal level and the state level and local levels. And I particularly interested in the public service, especially healthcare services affecting the public trust. And previously, I had another governance presentation, which was held by OECD. And I thought the public trust is affected by social inequality. And second was, I remember, freedom of speech, which was presented by the presenter from Spain. And I thought the public trust is affected. The public trust is different from the different by the country and countries. Can you understand what I'm saying? I'm so sorry, I cannot express. But public trust varies by from the country to country. That's what I thought. And public service, I think public health is, I believe, is more important to consider from now on, because COVID has been spreading fast. I'm sorry.
No, this is okay. I mean, we understand, and of course, your point that context matters, and this was what from the beginning, actually from the beginning, and when Victor, Margaret, I mean, you highlighted what are the contextual factors and what are the models and how these can influence. But if you'd like to comment and after invite the next, actually we have Gerd Buchert from the Catholic University of Leuven, who had for decades significant research on trust. But let's first give the floor to Margarita or Victor. Would you like to comment on the Japanese point of view?
Will say that maybe Adrienne, because she was talking about the differences about the data that we have from federal, state, and local government.
Thank you, Margarita. Yeah, yes, of course. As Nakamura said, public trust is not just different from country to country. It is, and in the case of Mexico or in the federal countries, it's different from federal government to local governments. In our case, for example, I didn't show because of the time, but if we relate or correlate the trust in government with public services, specifically to the healthcare systems, it's a very high. So imagine in the middle of the crisis, the pressure on the healthcare systems. And this, of course, will be a driver for the next season of the trust in governments. And it will be, of course, affect the trust in local governments. Why in local governments? Because not in federal government. For example, federal government in the case of the in Mexico is responsible to give every day, as Margarita said, every day in the afternoon, they give a report of the situation of COVID, nationwide, and also local. But imagine the people who is going to the healthcare system, they identify as a local service. Even if it's a federal or it's local, they identify as a local service. So they measure the trust, the quality of government, the quality of service according to how they experience the healthcare system. And of course, the data is totally different between states and also from federal and local. Thank you.
Okay. Yes, Victor, quickly, yes.
Very briefly, yes, I would like to also, because the question was a bit more on Mexico, but I think also if we apply that to Europe, at least all the research that we have shows that when it comes to trust in government, we cannot talk about nation states in Europe. We can only talk about regions, about dozens, I mean, or almost 200 regions across Europe, each one with its specific trust in government. As Adrian has mentioned now, it doesn't matter so much whether the competences are actually delegated are in self-governing regions or not. But citizens perceive the services are provided different in northern Italy from southern Italy, in Romania as well, Belgium, Spain. To be honest, there are more differences in those countries that rank on the average and below the average than in the top ranking countries. So in the countries like Germany or Scandinavian countries, countries with high level of trust on government, there are also less variations across regions. So there is something in, let's say there are champions in regional terms in different countries, and that matters. What has to do with the COVID? I think it's still very premature to take a decision to see an effect. But for example, Rodriguez Pose has this kind of provocative thesis that what matters is not so much the level of trust on government, but the decay on trust on government. So it matters. It doesn't matter so much if your region is perceived as highly competent by its citizens or not, the regional authorities or the public services in that region. But what matters is if there has been a decay. If citizens perceive that, like in northern Italian region, there has been a decay in the that may have some effect. So on citizens, maybe increase this idea of fatigue of COVID-19 or fatigue of the measures of government, because people think that the governments are losing the greatness they used to have. Just a tiny mention on that. Thank you very much. Thank you for the question.
Oh, thank you. Yes, Dustin?
Yeah, real quick. I think one of the things that I'm taking away from this conversation, and I really do appreciate the amount of data and evidence that we're bringing into this discussion, which is so critical because I think we can all get very comfortable with waxing philosophically about the need for improvement and trust in government. But I think what our leadership are increasingly looking for is actions they can take that they have some degree of confidence when they pull a lever, they can get a certain result. And I think this research that's being done right now is extremely important to help inform what levers and tools we have and increase the likelihood it's going to have the intended effect as we work through implementation. So I just think it's absolutely a critical discussion. One of the questions I would love to pose, and maybe some additional work that could be done, is I think moving from kind of the concept of trust in government at a broad level to really focusing in on trust in specific government institutions. I think the research I saw from Mexico and others is just so helpful to disaggregate. OECD did a wonderful study in Korea that also kind of disaggregated and really kind of helped peel the layers of the onion back to understand just what extraordinary differences emerge when you ask a more narrow question. And I think that's certainly been true, for instance, in the surveys we see in the United States. People, hate Congress, but they love their own congressman. They hate schools, but they love their, the public education system, but they love their own school. And so it really helps, I think, policymakers to understand where they need to focus, because there is a clear disconnect or problem versus getting too focused on things that maybe be beyond our control. And I think having a belief that if you focus on strengthening institutions where there is a clear problem, as you systematically do that, it will eventually build up to maybe affecting kind of the overall trust in government. So I think that the question I'd have is just continuing to push forward on more research that asks the question about trust in government institutions and service levels, and really kind of focusing at that more granular level. I know, for instance, being able to then also not just look at one institution, but actually be able to disaggregate it by the actual facility, right? By region, by state, by actual kind of work units, helps take, for instance, the survey research that we saw and understand, is this a systemic issue that requires a whole kind of rethinking, or is it a high degree of standard deviation that exists? And so you have some areas that are actually doing quite well and some locations that are struggling, which I think is exactly the kind of insight that our policy officials need to know to help guide what type of solutions needed for the specific area. Because I don't think there's ever going to be a silver bullet here. It's going to take some hard work and really kind of a lot of follow-up conversations to get to the truth of what interventions needed. This is an excellent point, and when we go beyond the big trust as an aggregate, I'd like to really invite Gert Bucher, because for decades he published and he made this distinction between the so-called confidence indicators. These are linked to the specific public services and, of course, the big trust indicator in government. So, Gert, it's great to see you, and the floor is yours.
Yes, thank you. Can you hear me?
Yes.
Yes. So I think two things, thank you for the interesting introduction. I think two things have not really been mentioned. The first, trustworthiness is based on ability, benevolence, and integrity. And on the ability part, what has not been mentioned is the role of experts. And I think one of the crucial parts, if you look at the surveys, is that in many cases, the trust in the experts was actually higher than the trust in the government. And I think the tension between experts giving policy advice and the government that had to take decisions has been a crucial issue, which has been deteriorating, especially since not just medical experts came on board, but also then for rebuilding society, the economists. And so you see that tension between experts here. But the experts have actually leveraged the trust in government in a way by being very firm in their communication. The second thing is, I predict a decline in trust because ultimately there will be a huge problem to reform and revamp the public sector to combine service delivery with chronic crisis governance. And I think that requires a kind of revamping the public sector, and this is not really happening. And the question for the trust issues will be, to what extent will the public sector be capable to combine chronic crisis governance and routine service delivery? Over to you. Thank you.
This is excellent, and of course, we a little bit touched on the resilience part and the innovation and how to. Nicholas mentioned the essential goods, but would you like to respond? And also, there are several questions in the chat functions in relation to the, the people-centered approach. How the fair design of policies, they are influencing the trust in government, but they also ask about very specific measures. For example, in Mexico, what measures the government use in order to increase trust in government? Or I can broaden this, in your country, what are the measures you consider the most effective in order to maintain or foster trust in the context of the crisis? So Margarita starting.
Yeah.
And after Victor.
Yeah, I think just one comment about the role that experts have played. I think that it has been very important, but also learning from previous outbreaks. For example, Ebola in Sierra Leone. In Sierra Leone, we have seen that it's not enough, and it's not just to use the experts, that we also need community leaders and local trust to help change that behavior. So I think that it is good to have the experts, but also, and I think that maybe this might resonate more for developing countries, where it might be a break between the experts or a distance gap between the experts and the majority of the community. Is good to use the community leaders to influence individuals' behaviors.
Excellent point, Victor, and after Adrian.
Yes, very briefly on the expert. There is a very nice survey experiment showing that the COVID-19 leads to 3 different reactions on citizens. On the one hand, they want more a strong leader, so like more trend towards authoritarianism. On the second hand, more involvement of national government and less involvement of supranational institutions like the European Union, exactly the opposite to what happens with other global threats like global terrorism or climate change. So citizens seem to prefer, when there is a health crisis, they seem to want to have the Leviathan. So let's say they want the strong, semi-authoritarian national Leviathan, awake that Leviathan in a crisis like COVID. But on the other hand, and along the lines of what Gerd, and thank you very much for his very nice points, points out, is like they want more experts, more decisions to be taken by politicians and not by experts. And I think that is all right, but I think we also have one example of extreme expert taken decisions, which is the case of Sweden, with all the decisions regarding the pandemic have been made by the chief epidemiologist and his bunker at the National Health Authority. There is in Sweden this ban of ministerial rules, so the ministers cannot order anything to the agencies in general. So this extremely total autonomy of experts have led in this case to this very peculiar government response that by all indicators, in comparative perspective with the neighbors, Denmark, Finland, and so on, has been quite poor. So relying on experts is good, but also may extreme delegation in experts without too much politician involvement. I am not going to say without democratic accountability, but without too much political involvement might lead to problems. And again, I come back to Fukuyama, Francis Fukuyama, when he talks about this U-shaped relationship between good government, or in this case also trusting government, and delegation autonomy. So the more you delegate on autonomy is good, but up to a certain point. From a certain point onwards, this might lead to a too isolated from the public, too unaccountable public policies. Thank you.
Yes, we reached the fundamental constitution principles now, and just Adrian, and maybe after I'd like to give one more opportunity for a question and conclude the session.
Thank you, Janos. I very briefly, I just would like to react to this concept that Gerd was saying about chronic crisis government. At this time, as you said, what the governments are doing in order to keep or to foster trust, I would like to say that maybe the governments are more worried about the crisis, and they are just keep the service, public service delivering in function, essential or relevant services, healthcare, public security, maybe justice, and some public transportation with restrictions and so on. Very few services. So they are worried just to keep in function. And maybe they are using some electronic platforms in order to deliver another services or to fulfill some obligations or requirements from the population. But if you have a government who were very strong in electronic means in order to have relationship with the population, of course you are going to be very, very strong at this time. But I will be worried. I am worried about the future, because in the future, in the close future, with restrictions in resources, with limited resources, many of those budgetary resources are going to be used in order to solve the crisis or to recover the crisis. Maybe I don't see that the resources are going to be to reconstruct or to reinforce the government in order to public services. So we have to decide as governments in which part of the government we are going to put these limited resources. And maybe the resources are going to be put in the recovery, economic recovery, or maybe health systems, or to the vaccine, or to many other things, but maybe not in the public administration in order to improve public service delivery. Thank you, Janos.
Thank you so much. So one more very quick question, and thank you so much, Miguel Ángel Becerra. You have been waiting for several minutes, so the floor is yours. Please ask your question and introduce yourself.
Hello, do you hear me?
Yes, yes, please.
Well, I'm calling from Spain. I'm a civil servant, well, a deputy director of the Spanish Court of Accounts, Court of Auditors. I belong, also represent in the task force of audit and ethics of EuroSci that Janos knows. I've been 3 or 4 times in OECD representing Spain, the Spanish Court of Accounts. Well, I have one question. Mrs. Margarita Gomez said that we are overloaded of information. Sometimes this information is not clear, is quite confusion sometimes. And then I want to pick one thing that is said by Adrian Franco about the experience data and perception data. In this situation of COVID-19, that we have plenty of news, sometimes fake news, or sometimes even different information, regional government, central government, etc. I have one question: which quality data must be used to get information by government? More experience data or perception data? Because I found that perception data now is weaker. Well, I can say that 2 years ago, in a workshop that we have had about integrity in the Court of Accounts of Spain with Manuel Villoria, who was the former president of International Transparency, said that in the beginning of the century, the perception of corruption in Spain was really low. But after 12 years ago, then a lot of new tools, a lot of control was enforced. The perception was really worse. But the real is that was less corruption. And then even the data collected by International Transparency about the experience, when they ask about perception, they say to the same people. Sometimes they are citizens, sometimes they are entrepreneurs, companies, people who represent companies. The perception was horrible about corruption. But when they ask, have you an experience about it? No. Do you know someone who have experience? No. Do you know someone who knows someone? No. Then, I mean, now in this situation that we have a lot of information, confusing information, do you find the same quality, perception, data, experience data to be collected in order to be trusted by the government? I'm not, sorry, I don't know if it's clear what I want to say.
Yeah, thank you so much. And of course, when we look at the data, for example, the feedback from the customers and their actual experiences or the perception, this is a big discussion, and probably we need to open a new webinar to discuss all elements. So I'd like to give the floor to each of the speakers, and thank you so much for staying with us and reflect on this experience and perception, but also give your final comments and your remarks in relation to the discussion today. Thank you so much. So maybe using the same, starting with Victor.
Well, thank you very much for giving us the opportunity to participate. I would like to mention one thing that before Janos, you have pointed out something very interesting, which is the use of new technologies and e-government and so on, how that can improve the trust of government. But I would like to emphasize that maybe we need to come back to old. I would be very happy if we use all tools. And I am putting you this very simple example. In Spain, during the state of emergency, obviously there were tons of cases, one of the countries with worse cases, but nevertheless, the hospitals, the public hospitals, they made an outstanding response. So the work of the professionals was magnificent. And one of the reasons is that when you talk with public managers and the healthcare officials, they tell you the reason is that we got rid of a lot of unnecessary bureaucracy that during many years we have been accumulating that prevent us from actually resolving problems. So we devoted our time to fulfilling papers and not to solving the problem. So when the state of emergency legislation left all that bureaucratic burden and red tape on the side, and then finally directors of hospital could contract buy the public procurement of the things that they needed and contract and hire medical officials and so on. So basically, this shows that many administrations like Spain and many others all over the world, they have not still made this basic transition from having a lot of ex-ante legalistic controls to a more ex-post transparent controls of results, not of procedures, but of results. And I think that if the COVID crisis can help us, can help governments to remind this very basic lesson of management that public administration, public government must respect the law, yes, but at the same time they have to manage efficiently the resources. So give a little bit more important to management and less important to law. I think that could increase trust in government. Thank you very much. I'm sorry for the detour, but I wanted to say this.
Thank you so much, Dustin. And your final comment?
Well, Janos, you know, I've sat through my fair share of OECD webinars and seminars and committee meetings, and this is right at the peak of, you know, time spent kind of hearing from a really wonderful cross-section. And I kind of was reflecting on what made this kind of last couple hours, I think, so strong. And I think we had a really good mix of scholars and practitioners that were kind of looking at this issue from different dimensions, but coming kind of with a common kind of set of questions, right, that we're interested in exploring. So I know I'm not shy about suggesting new work for the OECD. And one thought I had about how we keep this going is to really, we have a term in the United States, it's probably elsewhere as well, of pracademics, people that kind of have a foot in the practitioner world, but also kind of a foot in the academic world. And I would love to figure out a way to keep kind of a small network of people. And maybe, you know, for every one practitioner, you also have an academic, so it keeps the balance equal, which I think is really critical to furthering these conversations. So I would throw that out as an idea for a way of keeping this going. I think there is a lot of interest in this question around trust. And I think there is a community of people, both in government and in academia, that are focused on it. But I feel like we kind of somewhat randomly run into each other, rather than having kind of a real structure for engaging and sharing research finding and regularly, and using kind of practitioner questions to also seed the survey questions that we're doing and other research. So I'd suggest that be maybe a potential follow-up action, which we can discuss some more about how we really get a core group of people in both the practitioner and the academic world kind of rowing in the same direction on this in a somewhat regular way. I really appreciate the opportunity to be connected with such esteemed panelists, and thanks to OECD for pulling it together.
I mean, thank you so much, Dustin. And of course, we are looking forward to continuing next week, because this is the Public Governance Week under your chairmanship, and starting with the Performance Symposium next Monday. So moving to the next one, Adrian first.
Thank you, Janos. First of all, thank you for the opportunity, Janos, Monica, to share here with you, and thank you for all the people for the time and the attention. Just very quick, regarding experience and perceptions, it depends. Both are very important, are really important, data, experiences, and also perceptions. It depends on what you want to do with the data. This is the clue. And of course, there are several statistical and mathematical methods in order to generate and to produce high quality data on perceptions and also in experiences. And of course, this is not a competition between these two concepts. This is a complementary issue in any aspect of government. Corruption, public service delivering, in security, in trust. Maybe you ask to somebody, did you perceive that this government is trustable, or you have something that affects you from the government? It means it's a complementary. This is very important, and there are a lot of statistical methods to generate high quality information in both fields, perceptions and experiences. And finally, for me, regarding this webinar, we will keep the eyes on trust in governments. Of course, this is a very important, and at the end, it's like an umbrella of many topics, no, with many faces and dimensions. So, and also we have to keep the eyes on drivers of trust in governments. One of these, and very important, is the concrete relationship between governments and citizens, that is public service delivery. So for the future and now, of course we have to learn a lot from this crisis. If we don't learn, I don't know what is the concept, but we have to learn a lot from this crisis. As a government, we have to learn that we must have a different way to deliver public services and to dialogue with to construct the dialogue between citizens and the governments. And of course, the high quality statistics and data are a very important ingredient to construct this new dialogue between government and citizens in the public service delivering, and also, of course, in trust. Thank you very much, Janos, Monica, and to all the panel. Thank you.
Thank you, Adrian. And Margareta?
Thank you so much. So I would like to echo what Dustin said. I think that I will invite to move from talking about general concepts about trust, about public service, to more practical concepts. What do we mean by trust? Because also what we have seen is trust is very sensitive. I was very surprised about the data that Adrian presented about trust in federal government in Mexico. So we moved from 20%-ish in 2017 to 40%-ish now in 2019. So what we are seeing is trust is defined for many different factors. Here we can maybe attribute some of these to the identity with the leaders instead of the real performance of government. So I think that we need to start to digging deep to understand what are the factors that can have an impact on trust. And also one thing about understanding how people in general that are not experts on data make use of the performance metrics that we have about governments. And what we have seen from the evidence coming from behavioral science is that a lot of these evaluation that citizens do are based on subjective things, more maybe what Miguel was saying, sometimes experiences, but also emotions, how they compare with other services. So I think that is important. And finally, I think that when we talk about public service, we should not forget that we are talking about public employees, about individuals that work in this abstract concept of public service, and that there are practices, there are relationships, there is power there that we need also to try to understand better. Thank you so much.
Thank you so much. Thank you. Nicolas?
The problem with going near the end is that all the good things have been said, but many good things have been said. I think the only thing that I would add is, and what has struck me, is how much of the things we talk about around public trust are just good public governance practices. It relates to a lot of different things we think about in terms of how do we give services well? How do we make sure we're reliable for Canadians or citizens? How are we focusing on the things citizens care about? That all relates to public trust, but I think it's a nice, it's why public governance is focused on it, but it's a nice way of bringing together a lot of different important parts of good governance, all of which relate to public trust, both in the micro sense, as I think Margarita just talked about, in terms of how do we make sure individuals are having a positive experience, seeing messages they trust, and in the macro sense, how do we make sure that the institutions that have been set up in a country are perceived to be fair and to treat people fairly and meritocratic. It's a really interesting space and a really complicated one, and I look forward to the OECD solving it.
Thank you so much. And at the end of this webinar, I'd like to personally thank you on behalf of the OECD. Greatly appreciate this share of your insights, your views, and the discussion. This is the end of this webinar. However, you brought up that there are so many remaining issues, and we talked about, of course, the drivers, the levers, how to foster trust in the various contexts, the big context, the aggregated data. But at the same time, I think it's also time to see how to use trust, how to change behavior, how to improve impact, and what measure can track this. So I look forward to continue this dialogue and invite everyone. We still have over 80 participants. It shows how everyone is excited, because the next one is on the 16th of December, and the video and the summary and the slides, your presentations, they will be available next week on the OECD side. So I thank you all, the distinguished speakers, for sharing this information and your insights, and look forward to continuing this discussion. And I thank also my colleagues, the Secretariat, and particularly Monica Vrezzi for organizing this. So thank you so much, and look forward to continuing this dialogue. Thank you. Bye-bye.
Thank you. Thank you very much.
Bye.